If you're not making $158,000 per year, but you'd like to, I strongly encourage you to start a bookkeeping business. That's right. If you're willing to learn how to use a free
Good morning, everybody. Welcome to our 2024 Wisconsin Enrollment Conference. We're so happy to have you. We're doing the pre-licensing this week, so September 4th through September 6th. So we're starting off smaller as we do every year, and then next week we'll do the main conference. So thank you again for being here. And I just want to start us off with a few introductions and some welcome and just a little bit of information, especially for those who are doing pre-licensing, as many of you are who have joined. So I'm Allison Espeseth. I'm the director of Covering Wisconsin. And Covering Wisconsin, if you don't know, is Wisconsin's health insurance navigator agency. We've been around actually since 2003. And then have been with the Marketplace and the Affordable Care Act in 2010 starting, but then in 2014, we became the navigator agency to help with the Marketplace and Medicaid eligibility enrollment application. We've been hosting this conference since 2013 as well. And yeah, like I said, we're very excited to have you. So today there will be 3 sessions. There will be 3 pre-licensing sessions. So we have the applying for Wisconsin health coverage programs, and then there will be a session on Badger Care eligibility and application. And then finally, to wrap up today, we'll have a walkthrough of healthcare.gov, so the Marketplace enrollment and application portal. Before we get there, let me also take a moment to just thank some of our sponsors as well as our partners in making this event possible. So we work super closely with the Wisconsin Department of Health Services as well as Wisconsin Office of Commissioner of Insurance. They are just integral to this, making this possible and being here today. You will see a lot of them over the next several days because their content is what we try to make sure you all understand and have an ability to share with consumers that you're going to be serving. I want to also thank the sponsors that have helped make this possible. Their contributions have allowed us to support the work, the lots of work that goes into doing this event. So we have UW Health, United Healthcare, Common Ground Healthcare Cooperative, Molina, Security Health, Network Health, Chorus Community Health Plans, GHC of South Central Wisconsin, as well as GHC of Eau Claire, and finally the Wisconsin Hospital Association. I also want to acknowledge that as Wisconsin's health insurance navigator agency, a lot of our work is funded by the Federal Centers for Medicare and Medicaid Services. And acknowledge that their support of our team, of our capacity, of the navigators that you will see throughout this program, as well as others, is in part due to that funding that we get through the Navigator grant. I also want to acknowledge someone you will see shortly. So Elizabeth Rothy. Many of you probably have already worked with her. She is our workforce and affiliates liaison she is also a big conduit between both DHS and OCI in helping to make this, especially the pre-licensing portion, possible, and really just all the licensing, helping all of you, especially our navigator team, understand what is required, how to get through the process, because there's a lot of pieces. So I both want to thank Elizabeth for all of her work, but also introduce her. She'll be coming up shortly, and you'll get to know her and hear from her, and just appreciate all the work that she's been putting into. This is complex. There's a lot of pieces to the puzzle, and I know she does a lot of work along with OCI and DHS to just try to make it as simple as possible. And then I guess finally, just remember there was a slide as part of the introductory slideshow that we were sharing that talks through some of the very basics of just what do you want to make sure in order to get the credits that you need, because you're putting in all this work. We want to make sure you get the credits at the end of this program, at the end of the pre-licensing and the main conference next week. Make sure that you use your full legal name when you that will appear as part of your licensing when you log into the platform. That helps us just connect the dots and make sure that we are giving you credit, and then passing that on to OCI so that everything is squared away and that we don't have any miscommunication or disconnect about who should be getting credit and for what sessions. Be sure to attend every session. That's really important for pre-licensing, especially. All of these credits matter and do apply for ultimately your ability to get to be licensed for Wisconsin. All right, I think with that, I'm going to go ahead and hand it over, I believe, to Elizabeth to get us started for today. So again, thank you so much, and I really look forward to connecting with you throughout the program as well as in the future as enrollment assisters.
Good morning, I am Elizabeth, and I will be facilitating all of the pre-licensing sessions for the next 3 days with you. So I want to welcome you to our first day of pre-licensing. We are so happy that you're here and could join us. And for today, we will have 3 presentations, and they will be from the Wisconsin Department of Health Services and from Covering Wisconsin. Our first session is with Nikki and Maciel from the Department of Health Services, and we will be learning about applying for Wisconsin's healthcare programs. Nikki is a policy analyst and currently works in the enrollment and outreach section, focusing on elderly, blind, and disabled and long-term care customers. Prior to joining the enrollment and outreach section, she worked in the income maintenance training section, focused primarily on training EBD and LTC Medicaid to new income maintenance workers. She's worked at DHS since 2015, and prior to joining DHS, Nikki worked for Iowa County for 17 years. 11 of those, she was an economic support specialist with families, elderly, blind and disabled, and long-term customers. Maciel is an enrollment and outreach coordinator, and she works directly with community partner organizations who assist clients in enrolling and maintaining public benefits. Her role is to provide partner updates, communication, and policy clarification, troubleshoot benefit or case issues, and collect stakeholder feedback to report trends to DHS leadership on policy processes and issues. With her 20 years of experience with Wisconsin Medicaid, Maciel has used her skill and familiarity with eligibility requirements to advocate for recipients' rights for both the English and Spanish-speaking populations, identified systemic barriers, and collaborated with health providers, partner organizations, and the department to make needed improvements for Medicaid recipients. Maciel continues to be active in the community by attending several coalitions where she lends a keen partner perspective and develops strong partner relationships, which are essential to the continued efforts in providing optimal service for Wisconsin residents. I have been working with Nikki and Maciel very closely for pre-licensing for this year and last year, and it's been my pleasure to work with them. And I am looking forward to their presentation today. And I will go ahead and hand it over to Nikki and Maciel.
Sounds good. Thank you, Elizabeth. First of all, I just want to make sure everyone can hear me. This is the first time I'm speaking on air this morning, so I just want to make sure we're all good. Awesome. All right. Good morning, everybody. Welcome to session 1, applying for Wisconsin healthcare programs. I'm really happy to be here with you all today. Our session will end at 9:40 this morning, and then the next session will begin at 9:50. Questions can be entered in the Q&A box, and we will address those at the end of the session as long as we have time, and we should. So as Elizabeth mentioned when introducing me, I've worked with Wisconsin healthcare programs in one capacity or another for close to 24 years, but I'll readily admit I still don't have all the answers. So my coworker Maciel is also here with me to assist with your questions. But if there's any we can't answer between us or don't have time for, we'll be sure to get those answers back to Elizabeth so she can follow up with you all later. All right, let's go ahead and get started. Today's agenda includes the purpose of the training, program basics, how to apply for Wisconsin's healthcare programs, what to expect after applying, outcomes, and finally, resources. Let's start with the purpose of this training, which is to provide navigators, certified application counselors, partners, agents, and brokers with a basic understanding about how to apply for Wisconsin's healthcare coverage programs and what to expect throughout the application process. There are 2 other sessions I'll be presenting during this conference. Session 2, which is the 9:50 session this morning, will focus on eligibility rules for Badger Care Plus. And tomorrow I'll be presenting at 8:30, and that session will focus on eligibility rules for Medicaid for elderly, blind, or disabled individuals. All right, let's move on to program basics. Badger Care Plus covers children ages 0 through 18, parents and caretaker relatives of children ages 0 through 18, pregnant people, and childless adults ages 19 through 64 who are not receiving Medicare, except for Medicare Part B immunosuppressive drug benefits, also known as Medicare Part B ID. More details on Badger Care Plus will be given in the Badger Care Plus eligibility rules session. Medicaid for the elderly, blind, or disabled, also known as EBD Medicaid, covers individuals ages 65 and older, individuals who are blind, and individuals who are disabled. And again, more details on EBD Medicaid will be given in the EBD Medicaid eligibility rules session tomorrow. Most of Wisconsin's healthcare programs are administered by a network of county and tribal income maintenance, or IM agencies. IM agencies process applications, make eligibility decisions, and issue benefits. All IM agencies use the CARES Worker Web eligibility system, also known as CWW, to administer benefits. All program rules are the same statewide, and applications are assigned based on where the applicant lives. Most county IM agencies are organized into 10 regional consortia, and you can find information on those consortia at the link shown on this slide. Milwaukee County IM is administered by the Wisconsin Department of Health Services, or DHS, through Milwaukee Enrollment Services, also known as MILES. And Menominee County IM is administered by the Menominee Indian Tribe of Wisconsin. When someone applies for healthcare coverage, the IM agency considers whether the person meets all the non-financial rules for healthcare programs. For example, is the person a US citizen, or does the person have a qualifying immigration status? And whether the person meets all the financial rules for healthcare programs. For example, does a 67-year-old applicant have assets below the EBD Medicaid asset limit? And then, based on the individual's situation, which specific healthcare category is the most appropriate? For example, does the person qualify for Badger Care Plus or for a type of EBD Medicaid? When someone applies for full benefit healthcare coverage in Wisconsin, they do not have to specify which program they're applying for. The CWW eligibility system will determine the best possible coverage for the applicant based on the program rules and the applicant's information. If someone is not eligible for Badger Care Plus or EBD Medicaid, but might be eligible to enroll in a qualified health plan or QHP at the marketplace, their application will be transferred automatically to the marketplace. Now that we've gone over some of the program basics, let's take a look at applying for Wisconsin's healthcare programs. In addition to healthcare, Badger Care Plus, and Medicaid, people can also apply for other programs in Access, including food share, family planning only services, caretaker supplement as part of a healthcare or food share application, Wisconsin Shares childcare subsidy, Wisconsin Works, also known as W-2, job access loans, also known as JALs, and emergency assistance. People can also start a request for assistance for the Women, Infants, and Children, or WIC program. A person may use any of the methods shown on the slide to complete and submit an application, including applying online at access.wi.gov, applying in person or face-to-face, applying via phone, or applying by submitting a paper application. The filing date is the day a signed healthcare application is submitted to the IM agency. In most cases, healthcare eligibility starts as of the first day of the month in which the application was filed. Applicants can also request up to 3 months of backdating for most healthcare programs. Although please note that some pregnant people who are immigrants or incarcerated in a correctional facility, such as jail or prison, as well as children with higher incomes, do not qualify for backdated coverage. IM agencies have 30 days from when they receive the application to determine eligibility. Everyone applying for or receiving Badger Care Plus or Medicaid has the right to be treated with respect by IM agency staff, to have their civil rights upheld, to have their private information kept private, to get an application or have the application mailed on the same day it's asked for, to file an application right away, even if they're not in the correct office, and to get a decision about their application within 30 days of the day the agency receives it. Everyone applying for or receiving Badger Care Plus or Medicaid is responsible for providing accurate information, providing proof of information when requested, and reporting changes as required by the Program of Assistance. For more information on rights and responsibilities, see the Enrollment and Benefits Handbook, which is available at the link shown on this slide. All right, that brings us to our first poll question. Question 1, which is not an allowable way to submit an application? A, completing an application by phone with an income maintenance worker. B, mailing in a paper application. C, completing an application online at access.wi.gov. D, completing an application through online chat with an income maintenance worker. Or E, meeting face-to-face with an income maintenance worker to answer the application questions. Again, which is not an allowable way to submit an application. Hopefully you guys are seeing the poll, the live poll on your screen. Great. Maybe just a little bit to answer that. Okay. Great job, everybody. The correct answer is D. Access does not have an online chat feature for people to communicate directly with an income maintenance worker. Applicants and members with questions can call their income maintenance agency or member services. All right, let's talk about the different methods of applying for healthcare. We'll start with Access, which allows members to apply for and manage their state of Wisconsin benefits and programs in one place at any time. The Access website is, as shown on this slide, access.wi.gov. Access connects members to the help they need when they need it. One of the Access functions, titled See If You Can Get Help, is a short screening tool to find out which benefits you might be able to get. No Access login is needed for this tool. Another Access function is Apply for Benefits, which allows applicants to apply online for healthcare coverage, food share, caretaker supplement as part of a healthcare or food share application, childcare, Wisconsin Works or W-2, emergency assistance or EA, which is different than emergency services for healthcare, and job access loans or JALs. Applicants can also complete a pre-application for Women's Infants and Children Program or WIC. This takes them outside of the Apply for Benefits module, and their pre-application information is sent to the WIC clinic in their area. In some cases, applicants may be able to get an immediate eligibility decision for healthcare. This is called real-time eligibility. An Access account also allows members to check benefits, renew benefits, pay ongoing premiums, manage their HMO, report changes, view notices, and perform other benefit management functions. To perform these benefit management functions, members need to create, authenticate, and use an Access account. As a note, members can also check their benefits and do some benefit management functions on the My Access mobile app. More information will be given about My Access later in this presentation. All Access pages are available in Spanish by clicking the Espanol link, and users are able to view help text for questions that may need additional explanation. The Access training site can be used to teach people how to use Access. This site cannot be used to apply for benefits. You can access the training site at the web address shown on this slide. Walk-in and telephone applications are also ways in which applicants can apply for healthcare. Individuals have the option to apply in person at their county or tribal IM agency. They may also apply by phone. Each consortium has a central phone number for taking applications and other customer services. You can find phone numbers and office locations at the link shown on this slide. And the last method of applying for healthcare is a mail-in application. Because they have different eligibility rules, Badger Care Plus and EBD Medicaid have different application forms. The Badger Care Plus mail-in application, Form F10182, is available at the first link shown on this slide, and the EBD Medicaid mail-in application, Form F10101, is available at the second link shown on this slide. However, either application can be used to make a request for full benefit health coverage. And that brings us to our next poll question. Question 2, which of the following actions can a person not do in Access? A, request a fair hearing to appeal a denial of benefits. B, check their existing benefit enrollment status. C, view electronic notices about their benefits. Or D, report changes to their household situation. Again, which of the following actions can a person not do in Access? Great job, everybody. The correct answer is A. If an applicant or member wants to request a fair hearing in order to appeal a negative action taken on their application or case, they must submit their request to the Division of Hearings and Appeals, and we'll have more information on that later in the presentation. I've also just been given a note to maybe remind you all that the poll questions can be accessed at the by clicking the live poll button on your screen. So if you're not seeing the poll, you may need to click that live poll button to bring that up. All right, that brings us to what to expect after filing an application. Let's start with some information about who will be processing the submitted applications. Applications submitted via Access may include programs that are not processed by income maintenance agency workers. Income maintenance agency workers process applications for healthcare, food share, caretaker supplement, and childcare. Programs processed by other agencies include Wisconsin Works or W-2, Emergency Assistance or EA, Job Access Loans or JALs, and Women, Infants, and Children Program or WIC. Information in this presentation is specific to healthcare programs processed by income maintenance agency workers. Before making a decision about eligibility, IM agencies must verify the information the applicant has reported. In many cases, IM agencies can use data exchanges to verify the following information: citizenship, immigration status, earnings from a job, Wisconsin unemployment benefits, Social Security, supplemental security income or SSI, child support payments, and some liquid assets. In other cases, applicants may be asked to submit proof of what they've reported. Proof can be submitted by fax, mail, in person, or through Access or My Access. We encourage people to use Access and My Access if they can, because doing so submits the document to IM right away, and My Access allows people to use their cell phone to take a picture of a paper document and submit it. No scanner is needed. The agency will send a verification checklist or VCL titled Required Next Steps to Receive Your Benefits, listing the items that are needed and the date they're due by. A VCL will also be sent if the agency is missing information needed to make a decision and will include the date by which the agency needs the information. If an applicant does not provide the requested verification or information by the due date listed on the VCL, the application will be denied. So let's talk about that verification checklist or VCL. It lists verification requirements for Badger Care Plus or Medicaid, as well as caretaker supplement and food share if applicable. It provides the due dates for providing the information requested. It contains specific examples of documents that are needed, and it includes a document tracking sheet, which can be used to submit documents. The VCL, again titled Required Next Steps to Receive Your Benefits, informs the applicant or member that to get or keep benefits, they should read the entire document for details on programs, people affected, and deadlines. They should be sure to complete all tasks by their due dates and to refer to send in documents at the end of the letter for instructions. The first page of the VCL includes a summary of all required due dates and tasks to complete. Examples of tasks to complete could include actions to complete, questions to be answered, listed as answer questions, and proof documents to be sent in, listed as send in proof documents. As you can see on this VCL, the only task this member is required to complete is to send in proof documents. Agency contact information is found after the summary of all required due dates and tasks and before the first task section. Each task type listed in the summary will have its own section following the agency contact information. And here you can see the beginning of the only section for this example, the send in proof documents section. The send in proof document section continues on page 2, listing the proof needed, who the proof is needed for, which program or programs require this proof, and the due date of the proof needed. Additionally, examples of ways to give proof are included, as well as where to look and what to do if you need additional assistance. Finally, the Send In Documents section is printed at the end of the VCL, providing instructions for submitting documents, including how they can be submitted and where they can be submitted to. The case head's name will be pre-printed on this page with the opportunity for them to enter their phone number and the total number of pages being sent, including the cover sheet, as shown in the red box on the slide. Now let's talk about possible outcomes of the application. After the IM agency has verified the information reported on the application, the agency will make a decision about eligibility. The applicant will receive a letter telling them if the benefits are approved or denied. This is called a Notice of Decision, often referred to as an NOD, and is titled About Your Benefits. The Notice of Decision includes the following information: a summary. This section lists the benefits that have been approved and or denied, as well as contact information for the IM agency. Benefit details, including who is enrolled, dates enrolled, who is not enrolled, and if not enrolled, the reasons why. It also includes household income and deductions. These sections list the income and deductions on file for the household. Members should check to make sure that this information is correct when they receive it. And how we counted the income. This section lists the amounts and limits that were used to decide whether the member is eligible. Additionally, the Notice of Decision includes reporting rules. So if benefits have been approved, this section tells members what changes need to be reported to the local agency and when. It's very important to note that members must contact their IM agency or report changes in access. Changes reported to member services, which is the phone number on the back of the Forward Health card, or the HMO, are not shared with the IM agency. Finally, key contacts are listed. This section provides information about who members should contact with questions. And finally, fair hearing information is given. The last page of the notice provides information about fair hearings, including the date by which a hearing must be requested and how to ask for a fair hearing. So if benefits are denied, reduced, or ended, and the applicant or member believes the IM agency made a mistake, they can contact the IM agency directly to discuss the situation and try to find a resolution. If the applicant or member would like to request a fair hearing, they can ask the agency for help in requesting a fair hearing, or they can also directly contact the Division of Hearings and Appeals to request a fair hearing. We do recommend that members always try to work it out with the IM agency first, but not to delay filing a fair hearing if they believe that the decision is incorrect. At the hearing, a hearing officer will hear from the applicant or member and the agency to find out if the decision was right or wrong, and require the agency to take action as appropriate. After the hearing officer will send a written decision to the individual and the agency. And that brings us to our next poll question. Question 3. What is not included with the notice of decision? A, a list of who in the household is enrolled in benefits. B, the reporting rules stating what types of information the household must report to the income maintenance agency within a certain time period. C, information about how to request a fair hearing. D, a list of the income and deductions used to determine eligibility. Or E, permanent forward health cards from members eligible for Badger Care Plus or Medicaid. Again, which is not included with the notice of decision. I'll give you just a little bit of time there. All right. Great job. The correct answer is E. Permanent plastic forward health cards are not included with the notice of decision. If a person is a new member, their forward health card will be mailed to them separately. New forward health cards will not automatically be mailed to people who previously were enrolled in Badger Care Plus or Medicaid. These members can use their old card if they still have it. And we'll talk about how they can get a new card in just a bit. I do just want to note, though, that individuals eligible for real-time eligibility, which we talked about briefly earlier, remember that's when someone meets the criteria for an immediate eligibility decision for healthcare through access, and presumptive eligibility, which we'll be discussing more in the eligibility for Badger Care Plus session. Those people may get their notice of decision and a temporary paper forward health card online at the same time. But we don't provide permanent forward health cards with the notice of decision. All right, let's talk about receiving services. Each eligible person will receive a forward health card if they haven't received one in the past, which should be shared with providers when services are requested. If someone has received a forward health card in the past, they will not get a new one. So members should be encouraged to keep their card in a safe place, even if they are no longer eligible for health care, in case they have to reapply at a later date. Members can request a new card by either calling member services at 1-800-362-3002 or requesting one through their authenticated access account. Covered services are listed in the Enrollment and Benefits Handbook, which can be accessed at the link shown on this slide. Some services may require prior authorization. The provider will request authorization on the member's behalf. For some services, members may be required to pay a copayment or copay. However, monthly premiums and copays for Badger Care Plus or Medicaid card services must not be more than 5% of their household income. The 5% cost share limit applies to members eligible for Badger Care Plus, SSI Medicaid, and most EBD Medicaid programs. Members enrolled in MAP and senior care do not have a cost sharing limit. The limit does not apply to deductibles, patient liability for institutional Medicaid, or cost sharing for home and community-based waiver services. For members subject to the cost sharing limit, a copay limit will be set on a monthly basis. The copay limit is based on the assistance group's income used to determine eligibility. And copays are tracked based on copays the individual has incurred, not the amount of copays the member has actually paid out of pocket, since they may have incurred more than they've actually paid. For example, if the provider allows them to charge a copayment. Most copays range from 50 cents to $3. Providers may make a reasonable effort to collect the copay amount, but they may not refuse services if the member does not pay. For questions about covered services and for help with finding a Badger Care Plus or Medicaid provider, individuals can contact member services at 1-800-362-3002. Now let's talk about renewals. Members must renew their eligibility every year. The renewal process can be completed online, by phone, in person, or by mail. Members will receive a letter with instructions for completing the renewal approximately 45 days prior to the end of their 12-month certification period. In some cases, eligibility can be renewed through an administrative renewal. This occurs when the IM agency is able to verify all information through data exchanges. When eligibility can be renewed through an administrative renewal, the member does not need to take action to complete the renewal. However, members will be sent a summary of their case after a successful administrative renewal, and they are required to review it and report any changes or errors to the agency within 30 days. And that brings us to our last poll question. Question 4. Which of the following is false? A. Members will receive a letter with instructions for completing a renewal. B. Members always need to submit a renewal form to their income maintenance agency as part of completing their renewal. C. The renewal process can be completed by phone, by mail, in person, or online. Or D. Members must renew their eligibility every year. Again, which of the following is false? I'm going to give you just a little bit longer to go ahead and answer that. All right, great job. B is the false statement. Income maintenance agencies are able to renew eligibility administratively for some cases. This means that the member does not need to submit a renewal form if an administrative renewal was possible. They would just be required to review the summary sent to them and report any changes. And that brings us to additional resources. Members with an authenticated Access account can download the My Access mobile app to do the following. They can check their benefits to see the programs the member is enrolled in, including HMO contact information, and when their next renewal is due. Members that have been issued a Forward Health or Senior Care card can also view those digital cards. They can get reminders of actions the member needs to take or the documents the member needs to submit. They can take photos of and submit proof at any time, then check its status in real time. And they can update their home address, mailing address, and phone numbers. The My Access mobile app can be downloaded for free at the App Store or Google Play. Another resource for members is a Guide to Applying, which is available at the link shown on this slide and includes information about who can enroll, how to apply, required verification, benefits and services available, rights and program rules, and fair hearings. The Enrollment and Benefits Handbook, available at the link shown on this slide, is sent to all applicants and members and includes information about benefits and services available. Did I just do this one? Sorry. Program rules, required verification, change reporting requirements, covered services and prior authorizations, rights and program rules, and fair hearings. You can find information about IM agencies which determine eligibility for Badger Care Plus and Medicaid at the first link shown on this slide. And you can find information about Aging and Disability Resource Centers, which, among many other things, provide enrollment counseling for home and community-based waiver programs at the second link shown on this slide. Member services whose staff can answer general member questions, information about covered services, and help with finding a local IM agency can be contacted by calling 1-800-362-3002, which is the same number that's on the Forward Health card. And a fair hearing can be requested through the Division of Hearings and Appeals. Their telephone number is 608-266-7709, and more information about the Division of Hearings and Appeals can be found at the link shown on this slide. Some resources for partners include information about Wisconsin's healthcare programs, including member fact sheets, which can be found at the first link shown on this slide. Information for partners in Southeast Wisconsin, which can be found at the second link shown. And partner demonstration videos can be accessed on the Wisconsin Medicaid and Food Share Partner Resources for Eligibility and Enrollment Vimeo site at the third link shown on this slide. And that does bring us to our question and answer portion of the show today. So we're going to go to the live Q&A so that I can see if there are any questions here. All right. Sorry. All right. Copays are new since they were paused during the unwinding, correct? Which members could be subject to copays? Is it over a certain income limit? So, Maciel, do you know if copays were paused during the pandemic?
Yes, they were.
Okay. So they're new if they never received benefits before the pandemic.
Exactly.
However, if they did receive benefits before the pandemic, they did have to pay copays at that time. And I think we did go through which members could be subject to copays, and it's based on their income that's used to determine their eligibility benefits. But let me go back. Let me see if I can find that slide quick on the copays. Oh, is it? Yep. All right. So there are copays for Badger Care Plus or Medicaid. They are not allowed to be more than 5% of their household income. The 5% cost share limit applies to members eligible for Badger Care Plus, SSI-related Medicaid, and most EBD Medicaid programs. Members enrolled in MAP and senior care do not have a cost sharing limit though. And the limit does not apply to deductibles, patient liability for institutional Medicaid, or cost sharing for home and community-based waiver services. Did that answer your question, Michaela? Just want to make sure we're...
Excellent.
Okay. Wonderful.
Nikki, we also had a question in the question and answer portion of the meeting asking about express enrollment.
Yeah, I was just looking at that.
I just went ahead and I provided our partner email address. They're more than welcome to go ahead and email that inbox, and we will go ahead and take care of them. We need to verify whether or not their agency already exists as an express enrollment agency.
Sure.
First. So we'll
Sounds good.
take that back.
Yeah, so one of the questions our WIC team recently asked, what organizations qualify to perform express enrollment? So if you want to go ahead and send that question into the partner inbox, we'll be able to answer that through the inbox. Oh, and then it looks like there was some poll question issues.
And they will still get credit if they entered the information in the Q&A if they were unable to use the poll link.
All right. Any other questions about applying for Wisconsin healthcare? If an applicant or member requests a fair hearing, is there a cost for the applicant or member? No, it does not cost them anything to apply for a fair hearing. It's a great question. And in many cases, if they're eligible and lost eligibility, their eligibility may be able to be continued until the fair hearing. Any other questions? I'm just going to scroll back a little bit through the slides, make sure there are no other questions about any of this information before we... How do we determine what their copays will be? You won't be able to determine what their copays are. They'll be told when they pick up their prescription or when they go to their appointment how much their copay will be. Applicants who are required to pay a copay, would there be any changes to their coverage? You mean if they don't pay their copay? The answer to that is no. There's no change in their coverage if they can't pay their copay. Is there a way I can get the notes you are reading from? No, sorry, there isn't a script for the presentation. You should have been sent the slides though, or you will have access to all of the slides. It's my understanding. Okay. Okay. They post the presentations after the conference. Got it. Thanks, Michaela. So you will have access to the slides after the conference, at least. You will be able to print out the slides if you want. Any other questions? We've got the time, so I just want to make sure that all we have, if there are any questions, that we're trying to answer them for you. All right. Going once, going twice.
Obviously, on the last
Oh,
slide, Nikki, we have our email address, just in case they think of anything after the presentation.
sure. I'll get to that here in a second. Okay, there is a couple more questions. I'm going to get to the last slide and leave it up here. Sorry, don't look at the screen while I'm frantically scrolling through these. I don't want to get anybody sick.
Okay.
Yeah. Okay, so a couple more questions. Do you know if this will be on the test? I don't know if this will be on the test. I have never taken the test and don't know much about the test.
But we have worked very closely with Covering Wisconsin. We have worked very closely with OCI just to make sure that the materials that we're sharing would potentially be on the test. So please note that the information we're sharing is important.
Yeah, is relevant to the test.
Relevant, yes, absolutely. Thank you.
All right. I know you said the system helps determine who's eligible for what, but is there anything we can reference to know? So the handbooks that are available online in the resources slides that I gave you have all the eligibility rules in them. When we go through the Badger Care Plus eligibility in the next session and then in the EBD eligibility section tomorrow, that's going to help give you a better idea of which members will be eligible for which programs. I think that you'll have a much better grasp on that or idea of who will be eligible for what once we go through those eligibility sessions. The beginning pre-webinar slideshow mentioned an immigration webinar, but I missed the date time. Can anybody help with that?
I am double checking on that right now. I know it's going to be in October, but I also can put in our email to subscribe to the listservs because that'll also be coming out in the listserv. But I will double check and I can post it in the next session as well.
Great. Thanks, Elizabeth.
Of course.
And then, are there premiums for Badger Care? Yes, there are premiums for children for Badger Care Plus, and we will be going over that in our next session on Badger Care Plus eligibility rules. Great question. All right. Again, going once, going twice. All right. Well, thank you, everyone, for your time and attention today. Again, if you do have any further questions about applying for healthcare related to Medicaid or Badger Care Plus, you can send them to our partner inbox, which that email address is shown on your screen at this time. And we can help you out with that, hopefully. So I think that will end our first session, and our next session, I believe, begins at 9:50. Is that correct, Elizabeth?
Yeah, so we'll be taking, it's going to end up being now probably about a 20-minute break.
20-minute, yeah.
And so the next session is at 9:50 about Badger Care Plus eligibility rules, which Nikki mentioned. You should have received a PDF in your email inboxes with the link this morning around 7 o'clock. That is called Forming a Badger Care Plus Magi Group. So you'll want to make sure that you have this PDF for the next session. If you don't have it, please let us know and we can get it resent out. Otherwise, we will reconvene at 9:50.
Someone raised their hand.
Oh, yeah.
I don't know how that works. It looks like it's Lucia. I don't know if we need to just ask
Yeah, I
them.
don't know if we can unmute or if we can just put it in the Q&A.
Yeah, we'll leave it open. Lucia, if you want to just enter.
Yeah, I think you'll have to put it in the Q&A.
There's a question, Elizabeth. It says, do we just stay on?
So you can actually log back out, and then when you log back in, there will be a home screen that you can click onto the next session.
And then Lucia says, can you please resend me the email from this morning?
Yeah, we can absolutely do that.
Okay.
And you have her name.
Yes. Yep. Perfect.
Excellent. Excellent.
Okay. All right. Thanks, everyone. We will see you back here at 9:50.
Thank you.
Thank you.
Thanks, everybody.